In the treatment of methyl alcohol poisoning, we use ethanol. Ethanol 10% is administered via nasogastric tube because ethanol competes with the methanol for metabolic enzyme like alcohol dehydrogenase, and it will saturate that enzyme. Ethanol is a competitive inhibitor of alcohol dehydrogenase, so it will compete with methanol for the metabolic enzyme and it will saturate alcohol dehydrogenase. This will prevent the formation of toxic metabolites like formaldehyde and formic acid. So, because ethanol will saturate alcohol dehydrogenase, methanol will not be able to be converted into formaldehyde and formic acid, which are the toxic metabolites. Methanol is excreted unchanged in urine and breath. So, because methanol will not be able to be converted into the toxic metabolites, formaldehyde and formic acid, it will be excreted in the urine and breath in an unchanged form. Okay. तो मिथनॉल पॉइजनिंग में जो सिम्टम्स होते हैं वो मेनली फॉर्मल्डिहाइड और फॉर्मिक एसिड के कारण होता है. फॉर्मिक एसिड विल कॉज respiratory depression, acidosis, and retinal damage. Formic acid causes respiratory acidosis, respiratory depression, acidosis, and retinal damage. Formic acid causes retinal damage, acidosis, and respiratory depression. Respiratory depression, retinal damage, and acidosis. Okay. So if we use ethanol, the enzyme will be inhibited. ठीक है, जिसके कारण फॉर्मल्डिहाइड और फॉर्मिक एसिड विल नॉट बी फॉर्म्ड. तो अगर ये टॉक्सिक मेटाबोलाइट बन ही नहीं रहे हैं तो ये सारे सिम्टम्स होंगे ही नहीं. और मिथनॉल जो है इट विल बी एक्सक्रीटेड इन यूरिन एंड ब्रेथ. ठीक है. So that's why we use ethanol in the treatment of methanol poisoning. The treatment of methyl alcohol poisoning is patient is kept in dark room to protect the eyes from light, maintain airway breathing and circulation. Patient is kept in dark room to protect the eye from light, maintain airway breathing and circulation. Gastric lavage is done after endotracheal intubation. Maintain airway breathing circulation, then gastric lavage is done after endotracheal intubation. Intravenous sodium bicarbonate is given to correct acidosis and to prevent retinal damage. Then intravenous sodium bicarbonate is given. Ethanol 10% is administered via nasogastric tube. Fomepizole, an alcohol dehydrogenase inhibitor, is the preferred agent for the treatment of methanol poisoning. CNS depression is rare with fomepizole. This is the advantage of fomepizole, that CNS depression is rare with fomepizole as compared to ethanol. It can also be used in ethylene glycol poisoning. So fomepizole is used in both methanol poisoning and ethylene glycol poisoning. Calcium leucovorin is administered intravenously. Folate adjuvant therapy to enhance metabolism of formate, thereby decreasing its level. Calcium leucovorin is administered intravenously to enhance the metabolism of formate. Calcium leucovorin is administered intravenously, folate adjuvant therapy to enhance the metabolism of formate, thereby decreasing its level. फॉर्मेट के मेटाबॉलिज्म को इंक्रीज करने के लिए कैल्शियम ल्यूकोवोरिन इज एडमिनिस्टर्ड. हीमोडायलिसिस इज डन टू प्रमोट द एक्सक्रीशन ऑफ मिथेनॉल एंड टॉक्सिक मेटाबोलाइट्स. ठीक है. तो पेशेंट इज केप्ट इन डार्क रूम, मेंटेन एयरवे ब्रीथिंग सर्कुलेशन, गैस्ट्रिक लवाज आफ्टर एंडोट्रैकियल ट्यूब, एंडोट्रैकियल इंट्यूबेशन. इंट्रावेनस सोडियम bicarbonate, ethanol 10%, fomepizole, calcium leucovorin to enhance the metabolism of formate, and hemodialysis.